Let's talk. What you wanna talk about? Let's talk. What you wanna talk about? Kitchen talk. Let's talk. What you wanna talk about? Kitchen talk. Let's talk. Conversations that cool. Kitchen talk. Let's talk. What you wanna talk about? Kitchen talk. Let's talk. Conversations that cool. Let's talk. What you wanna talk about? Let's talk. What you wanna talk about?
Hey.
Hello.
Welcome to Kitchen Talk, CTC, Conversations That Cook. I am super excited about this conversation on tonight. Listen, we are like in 2025. Can y'all believe it? Like, it just seemed like, I remember when 1999 just seemed like Prince, you out of your mind.
Right.
And here we are in 2025. So on Kitchen Talk, we started out this year with Welcome 2025, and we've been just doing a variety of show topics and shows and just kind of digging into, that kind of New Year kind of vibe thing, like everything. Who is it? I think it might be a Ty Tribbett song. New.
Yes. Right.
Yeah, so I know, even though we woke up and we went right back to work then like the next day or so. So,
Oh, yes. Oh, yes.
But it's just something about saying, it's a new year. So that is where we are. So I am super excited to have you guys here. My show topic for today is about our health. So that is what we are digging into. I have a couple of other guests that will be joining us. My guys, everything new. My guys will hopefully be able to pop in, here and there. But they got some new things going on with them. But you know what? Who run the world?
That's right. That's right.
So I think we can hold it down for this hour. I am super excited also because I got to reconnect with another baby rattler.
That's right.
It's been like we see each other in passing, but it's been like a while.
A long time. A long time.
A while, yeah.
It's nice to see you again.
Absolutely, you too. And then connect with and I've seen you, Dr. Westbrook Stewart's around campus as well. So
in the LLC meetings too.
You know what? I saw your picture pop up today. I was like, oh, okay.
I got on right before I was headed into clinicals. I was in the hospital.
I was like, oh, okay, yeah. I think I seen her face. So it and I was telling I'm just gonna call her Lisa. I was telling Lisa when we talked, I was like, we all live right here in the same city, and unless we actually, like my classmates or whatever, and unless we say let's get together, it's like we never see each other.
Right. Or unless we have something on campus that we run into each other.
Yeah. So that is just so crazy. So this is our topic for tonight. I'm glad you guys were able to join us. I am super excited, and we could just dig right in. I do not do anything too formal, just because I'm a very creative person. So I'm like, let's just go where the conversation take us, and it's gonna be all right.
All right.
Yeah.
Okay,
so ladies, tell me about your new year. Like, do you have like a personal health plan or goal or whatever for your new year?
Go ahead, Dr. Gardner.
Well, of course. always the new year comes around, you say, okay, you're going to do better on everything. Planning, eating, exercising, always the same thing. But usually I'm not a New Year's resolution person at all. I just try and live like a healthy life throughout, So, but for some reason, I was excited about 2025, about the new possibilities of everything. So, and we just doing a lot of good things, especially in the School of Nursing. So I think that's what got me so excited. So again, I remember when that 1999 song came out, and I was like, it was so long ago, or far away when we heard it. It was like 1999, and now 2025. One more day in January, and we're going into February.
Yeah.
So the time is really moving fast.
Yeah, absolutely.
I know for me, but 2023, I started a weight loss journey to try to get some of the weight down, especially, we very mobile and the agility and moving around. So I did that for myself. I gave myself like 2 options. I knew what by the time I was in, I felt, you see your patients and stuff, like we see patients at the bedside and stuff, and some of the stuff they go through with the weight being an impact. I just knew with how I move around, even just outside of work, that kind of stuff, I needed to get some of the weight off. So for me, 2023 is when I started, but I didn't really see it until towards the end of 2024. And like you said, coming into this new year, and you see the changes you worked on and started making, you're sticking to it. And so I know for me, trying to stick to keeping the weight off, like you get it off. And a lot of times it's so easy for us to put it back on. Me getting it off and keeping it off. And then when Dr. Gardner was telling me about some of, just some of the things we might speak to, whatever, I personally, even though we work in healthcare, we're not always consistent with going to our own doctors and getting our own exams and stuff like that. So I had a lump in my breast actually come 2023. I found a lump in my breast, but I didn't go get it checked out. My last mammogram was like 2022. So January 2nd with the 2025, the new year, I said, let me go get it checked out. So I did go for my mammogram. The left breast immediately came back, no malignancy, but I had a concern for the right breast. So I had to go back actually just Tuesday. Had to go Tuesday and get my diagnostic ultrasound and another mammogram, and got my report today, no malignancy. So so yeah, the lump is still there, but we're just watching it and everything's good. So just speaking to those screenings and those things and being compliant with our own health, but not even just taking control, but feeding into ourselves what we feed into others.
Thank you so much. That was like so nice of you to share that with us here on this platform. We talk about, like I was telling Dr. Lisa, we talk about everything. And so for you to be brave enough to share those moments with us, that is wonderful, because a lot of times we do, as women, as people, as whatever, we're busy, or we'll get a little. I'm one of those people too. If something hurts me, I'm like, oh, okay, it'll
go away.
It'll go away. I ain't got time to go to the doctor. I don't feel like sitting in the office, whatever, until it could be something that's really, really, whatever. And so it is important that when we see signs of anything, that we, figure out what that is. I think I heard a medical professional say, if you have a symptom, then the problem is already there.
Correct.
Right.
I was like, wow,
that's absolutely
never thought about it that way.
That is correct.
Like it's already festered. It's already a problem that you need to have looked at. So yeah, our body tells us, different signs. Different signs. This is one thing I want to go back to that I failed to mention, that Dr. Gardner is the associate dean at the School of Nursing at the Florida Agriculture and Mechanical University. And Dr. Westbrook Stewart is an associate assistant professor in the School of Nursing as well. And they have a litany of degrees. So I just wanted to let y'all know it's some powerhouses in the kitchen tonight. But I appreciate you guys taking time out of your schedules to come and chat with us. So I know for me, one of the things that I first come to in a new year, I do think about my health, and I do think about different things that I may want to do, um, and the fact that I'm getting older as the years, and then like some things like when I turned 40, I was like, oh Lord, my knees are musical.
Right.
What happened? What happened? But do you think that you guys kind of automatically go to the medical because you're in the medical field? Like for me, my first thought was for this year, I wanted to give myself a word that I was going to live by for the year.
Mhm.
And my word is action.
Mhm.
And
That's
so
good.
that was what I want. So whatever it is that I am thinking of putting my hand to, I want it to be more action. Last year we did a lot of planning. Last year we did a lot of strategy. Last year I did a
Mm-hmm.
lot of thinking. I'm gonna do this. Or I'm gonna do that. So my word this year is action, and that is in every part. Now I haven't gotten to the exercise part of the of the health journey. But kudos because I did get out of one of the clubs that I've been trying to get out of for years. So I'm happy to be out of that club. But the crazy part is I wasn't really trying, but I was like being a little more intentional. So it wasn't like,
Mhm.
oh, I want to lose weight. It was like I want to be a little bit more intentional about what I eat, I
Mhm.
eat out. I eat out
A
Mhm.
lot, yeah.
Mhm.
and it's like it's just me. So it's like when I run, I could just run here and pick that up, and I'm good.
Mhm.
Or
Mm-hmm.
I don't want to turn on the stove to try to cook a
Mhm.
meal for one person. That's just
Right.
it's crazy to me.
Right.
Mhm.
Whatever. So I have been a little bit more intentional and utilizing my freezer. So if I could pack it up, put it in the freezer
Mhm.
for later,
Right.
whatever.
Right.
So can you all speak to maybe something of that nature, like the things that we put in our bodies?
Mhm.
Oh
Good.
yeah. So a big component of healthy living is really what you eat. A lot of people, when you try and live healthy, lose weight, a lot of individuals think about exercise,
Mhm.
but 80%, and some people say 90%,
Mhm.
is what you eat, what
Wow.
you put in your body. And if you notice, I know I can tell if I kind of go off to the left and start eating out a lot, your body can feel it.
Mhm.
Okay. And what better food is the food that you cook at home?
Mm-hmm.
Because even though you may try and go out and eat, say like if you go to Chick-fil-A and get the grilled nuggets,
Mhm.
and that kale salad, oh, that's so healthy, but they still have ingredients in it, they have preservatives in it, so it's better to cook at home.
Mm.
So, and you can really feel it, as well as you can see it. Weight loss. I guess we're going to talk about some screenings, but even when you get your lab work
Mhm.
done, it will really show.
Mhm.
Yeah, I can attest to that because for the month of January, I did try not to eat out as much and to cook more, and kind of in December a little bit too. And I really, really can kind of tell the difference.
Yeah,
Yeah.
yeah. You feel a lot better. It's like you
Mhm.
feel lighter because when you're cooking, your food is healthier.
Mm-hmm.
And you can, like she said, you controlling those ingredients. A lot of times
Mhm.
too, when you think about inflammation and the salt intake, and you know we're
Mhm.
already predisposed to certain cardiovascular issues, being African American, whether women or men, and you can control what your food is being seasoned with. And then when you're, like she said, with the ingredients being put in the food, and you can feel it in the retention, in the salt retention, the tightness, like I said, the inflammation, the water retention. Yes,
Mm-hmm.
like doing those things, and like she said, preparing your food at home and stuff, it does make a difference. You do feel it when you eat too much of that salt prepared food in the streets, even if, like you said, even if it is healthy, you feel that difference.
Definitely. I am a French fry junkie.
And even, like McDonald's, so their fry, they try not, or even like she said, Chick-fil-A, they say not so much salt, but it still have that salt and stuff in there.
That's
I'm just
right.
telling you, French fries are my friends. I love them. They comfort me.
And
You made
McDonald's
on at
have the
home.
best fries.
The McDonald's, but you know what?
Yes.
McDonald's fries have changed a little
They
bit.
less
Oh,
than
they
the
have.
salt.
Yeah, that's nothing that I always do,
Yeah,
every now and then. But I do remember being
yeah.
the best fries. So they have
McDonald's
changed.
had the best fries hands
They
down.
they call themselves
Mhm.
decreasing the amount of salt that they put on it, but it's still salt nonetheless.
Yeah,
Mhm.
they take it from the French fry queen. They are not like they used to be.
Not to say.
They are not the same. And maybe that's just the Lord saying,
He's gonna help
Back
make
and
those behavior
stop.
modifications.
Cut back and stop.
right. Right. I will say I'm doing better. I will say I'm doing better, but oh my goodness. Oh, I love
Yeah.
French fries. I love French fries. So much so that my mom bought me French fry earrings.
Oh, you really love them.
I really
Oh
do. I really
gosh.
do. I really do. But I will say I'm doing so much better. I will say I'm doing so much better. So
Yeah.
let's talk about maybe some of the things that we should be I know nobody likes to go to the doctor.
Mhm.
None of us do. And sometimes we only go when we absolutely have to.
Mhm.
Mm-hmm.
Which is still not always good because
Mhm.
but there are things that we could do as medicine or pre-health or whatever I don't even know
Mm-hmm.
what the word with preventive
Mhm.
Mm-hmm.
measures that we
Yes.
can that we could do that we probably should do annually. So what are
Mhm.
some of those things for men and for women?
I let Dr. Katoria take the lead this time, and I come in. I don't want to talk all the time.
Something as simple as going for that annual checkup, like Dr. Gardner mentioned, those labs. Like she said, a lot of times the reflection of what we're putting in our body will show up in our labs. You don't know, a lot of times the pains we excuse in our heads, having those headaches and things, could be because you're having high blood pressure or high cholesterol issues, which you may never know until you go get those annual labs and they're looking at your lipid panels or your lipid profile, and those numbers come back up. Even sometimes, even just sometimes something as simple as talking to your parents and find out the things that they're dealing with, which will make you go and get those screening, those preventative checkups
Mm,
for what you might potentially be dealing with. Because a lot of the things that impact African American men and women, cardiovascular events, even breast cancer screenings, sometimes too, our parents are dealing with those same issues that unless we prompt them or ask them, they're not going to share with us. And you don't even know that we don't know that we could have high cholesterol already sitting in our system because of the predisposition, from our
mm,
family members. Because case in point, the example I just gave in my own story with the breast lump, mentioned it to my mom what I was dealing with, and she told me she's had a lump in her breast since she was 18.
oh
So if
wow.
that was something that I had knew already, I would have been more alert or more on top of, being consistent with doing my my yearly mammograms.
Right. And a lot of times when you go for these annual physicals, a lot of people really don't know that they are diabetic,
Mm-hmm.
have high blood pressure. When you go for these physicals, they're going to do a head to toe assessment.
Mm-hmm.
They're going to do a skin assessment. Even though we're African Americans, we also can get skin cancer as
Mm-hmm.
Mm,
well. So just think, you don't have a glucometer to look and check your blood sugar. So if you go every year, or if you skip and go every other year, you may be pre-diabetic, or you may have diabetes. So that's why it's really important that you go. And I try and go, try and do a specific date. A lot of times we tell our patients, try and go every year on your birthday, okay? Or every year around Christmas, something that you're going to remember. But it's really important to make sure you go and get your annual physical. And now I think the majority of the insurance companies pay for your annual physicals. You don't have to do a copay or anything. So that's really important. The catch, we're doing preventive measures.
And so those are like, when you say physical, that's like for women getting the pap smear.
Oh yeah. Okay.
And
Let's get on that. I like that. You know, that was my area.
dig on in, Dr. Lisa, dig on in. Go ahead.
You know, that was my area for almost what I did, 17, 18 years on that. But we tell the females, a lot of, especially young females, they really don't know what a pap smear is. Okay, they don't know what a pelvic exam is. You know, so we try and educate them and let them know, even though they recommend pap smears at a certain time, if you're 18, they're not recommending a pap smear. But if you're sexually active, you need to have a pelvic exam so we can examine you for all types of STIs. Okay. So they was like, oh, I don't want a pap smear. You know, don't have to have a pap smear because you're not of age, but you do need to get examined, you know, because you are sexually active. So for women, yes, we need our pap smears. With the pap smears, we need HPV, the human papillomavirus. You know, of course, they have the vaccine for that. That's if you get it, but you still need to be screened for it. And I recommend a pap smear every year. I really do, every year. And screeners, I recommend whenever you are sexually active, at least once a year. But more if you're sexually active, have multiple partners, have unprotected sex. So it's a lot of education that you have to do when you're talking
Dr.
about that.
Lisa, what's the difference between what you just said about the pap smear and the pelvic exam? I thought they were the same thing.
Okay, so a pap smear is a test that we do when we do the pelvic exam. So you do the pelvic exam when you have the speculum and you go in, and we're actually looking externally. We're looking for any lesions, you know, sores or anything like that outside. We're also looking on the inside for any lesions, sores, or whatever. Then we're looking at your cervix. And the pap smears, when we take cells from your cervix, you heard about cervical cancer, right? That's how you determine. We take cells from your cervix, we scrape it out, and then we do an exam, the pap smear. That's what it is. And that's the difference. So you can have a pelvic exam without having a pap smear. Okay? So those are two differences.
Oh. I never knew that. And so there's an age to the pap smear?
Yes. So, and insurance companies really won't pay for it. When I was at Student Health, I think it was 21. And when you have your first pap smear. And of course, you know, females, males, okay, but females get pap smears. You know, they start having sex a long time before they get 21. So that's why it's really important that whenever you become sexually active, you have to get your pelvic exam, you know, checking for STIs. And even if you don't do a pelvic, you can still check through urine. You can do the chlamydia, the gonorrhea. And if a girl is really young, they don't do a pelvic exam. They would just have her urinate in a cup. And that's screening for STIs as well.
Okay. Okay. And then men get the prostate check, but that's an age thing too, right?
Correct.
Right, right. So you want me to talk about it?
Yeah,
Sure.
go
Yeah.
All right, let's go. Okay. So yes, the men get prostate, and that's a whole nother, educational method because a lot of guys don't like to get
Mhm,
prostate exams. We recommend at age 40,
mhm,
unless they have like a family history or anything like that. But a lot of guys don't like to do the pelvic exam. We kind of educate them to explain to them when you have your pelvic exam, we're feeling I mean, not pelvic, your prostate exam, we're feeling your prostate to make sure it's not enlarged because we
mhm,
can actually feel to see if it's in the nodules or if it's enlarged. But if they still do not want the prostate exam, we can do a blood test, a PSA,
mhm,
and that can look at the prostate levels and see if you are at risk, if it's elevated. You have to rule out, make sure it's not benign prostatic, what we call enlarged prostate. And then you need to make sure it's not prostate cancer.
mhm.
Mm.
So that's a tough thing trying to get guys to, do the prostate exam.
But like she mentioned, we can encourage the blood test if the just to get them in that moment to guide them
Hmm.
towards the actual exam, like she said. So that's another thing with screening. They can start at least with the blood test and make sure they continue to follow up if they don't want to do the prostate exam first.
And it sounds like it's really important to know like your family history, your family,
Mhm,
medical history as well as like your tree, you know.
mhm.
Yes, yes,
We
yeah.
come from a lot of broken trees, a lot of us. So
Mm. Yeah, my tree is very blended.
Oh gosh, but when you start talking about that prostate, the guys
they
just
tense up.
change the subject. Yeah, tense up. They don't want to talk about it, but you have to
Mhm,
put it in a way that it could really affect a lot of you know manhood problems if
mhm,
that prostate is enlarged, continue to enlarge, and it can lead to prostate cancer.
Mm, wow. So it is important to have those screenings done, and they do that one every year as well, right?
Recommended, yeah, and
Recommended every year.
that one you can really catch, but you hear a lot of prostate cancer. Um, you find it late because they don't get the screening.
Mm,
mhm.
wow. Wow, we have a lot of things to consider when it comes to our health. What about are there different screenings for like cardiac conditions that we should get each year or respiratory issues or whatever that we should get each year?
Like we were talking about earlier, as far as the cardiovascular events, just sometimes going for your routine physical exam, getting your blood pressure checked. If you're not going to go frequent intervals, just going and getting it checked. And like she said with the men earlier, how they tense up, even just the prostate, they'll tense up, or they might be resistant to just going for that physical just to get something as simple as a blood pressure check. But if you explain to them and present to them that you can end up having manhood issues, they'll be more inclined to go and get it checked. Because when you think about the prevalence of like kidney diseases, people ended up on dialysis from the
Mm,
renal failure
Mhm.
and stuff because of unmanaged hypertension they didn't know that they had. um, or even just if you find out you do have hypertension or cardiovascular issues and you're not compliant with your medication, it can lead down that pathway of renal failure, end stage renal disease and stuff, dialysis. But you can start having impotent problems, manhood problems.
Mhm. Mhm. That's right. And like Dr. Westbrook said, you can really catch it
Mhm,
because when you go and get screenings, you're doing a blood pressure. If your
mhm,
blood pressure is elevated, they may want to do an EKG. And that could really identify any type of heart problems. And then you continue to go on to find out if it's anything abnormal. You can, catch it just by doing your screenings.
So what would you guys say in your medical opinion or seeing patients or whatever? Why are we so resistant to the doctor, to our health issues and things like that?
I think sometimes it's the stigmatization, or I would say sometimes some of the bedside manners some of the providers might have when they're not culturally sensitive. In nursing, we teach holistic care, that culturally sensitive nursing care, treating the patient as a whole. So sometimes physicians are taught from a different medical model than nurse practitioners or nurses are taught. And the bedside manner of communicating or conveying to whatever your target population is doesn't always translate over, and you only need one negative experience, whether it's with you or one of your loved ones, and that's going to deter you or push you back. And even like we were talking about the weight loss, I know personally for me, from my experience as a patient, and I was able to translate it as a provider to be more passionate or be more conscientious on when I have my obese patients and trying to talk to them about weight loss, or even trying to promote them towards the healthier eating habits and stuff. I remember experiences I had with physicians where you might go in for your physical and they make you, it's almost a berating or a condescending approach at the bedside sometimes. And all it takes is one experience. It's going to push you back and keep you from going to the doctor. I remember watching a video one time where you had the doctor sharing an experience of why he had a black patient, but they went and get off the phone with whomever was on the phone with them, because there's a distrust in the African American community sometimes amongst providers because of all it takes is one negative experience. So I think that sometimes that stigmatization pushes people away from going to the doctor. We usually say white coat, syndrome sometimes, but I think, for us more mature and seasoned individuals, it just takes that one negative experience sometimes, and it'll keep you from going even when you should go or you gotta go, kind of thing.
Right. I absolutely agree. Yeah. Then with the history, Tuskegee, and then with the COVID, that what happened with that. So that just really, in my opinion, put us back, for being trustworthy. A lot of African Americans, they don't want to get any more vaccinations. It was some that were receiving the influenza, before that. Now they don't want to get that. So it's the trust, and like Dr. Westbrook said, it's the provider. So it's a lot of factors that cause a lot of individuals not to be seen.
Yeah,
and unfortunately,
go ahead.
No, I was saying, and unfortunately, that can lead to a lot of problems, negative problems in their health.
Yeah, my thought was definitely the mistrust. And then the other piece for me that I've heard, not so much experience, maybe a little, of the not being heard. If I'm telling you that this is going on and you're just saying, this is one of the reasons that I just deal with female doctors. Because I feel like, they can understand my plight a little better instead of just saying, oh, it's all in your head. Well, it might be, but you need to figure out and how to get it out of my head, whatever. Or the wait and see approach. Well, let's wait and see. Well, if I'm coming to you, I done already
waited.
Right. Right. Yeah. And see, nurse practitioners, we are more preventive, and we're trying to first have you prevent. But if it's occurring, we're going to find out what's going on. We know you have already done your research and whatever that you need to do. So we're going to try and, really, our approach is like Dr. Katoria mentioned earlier, nurse practitioner and physician approaches are completely different.
Why is the training, or as you were saying, why is the approach different? Like, why is the training different? Do you
I,
guys think?
I think the medicine model hasn't caught up with the nursing model, because back, and Dr. Gardner knows, back the medicine model is different. And predominantly most of medicine is built on the medicine model, the Institute of Medicine, the medicine model, and they're trained like the bedside communication, even how they look at the disease process is a lot different. It's more of a reactive approach. Like she said, we're trained for preventative medicine. The medicine model is more of a reactive approach to a disease process that is already probably started or too far gone kind of thing. So they're reactive to medicine versus on our end, when we look at the holistic model, the nursing model built upon it, we're more of the prevention and the whole patient.
Oh, okay. So it's like the nurturing parent and the parent that's like, all right, let's just do this.
Right.
Correct. That's
Here
correct.
you go.
Right.
Don't
Versus
take
the
this.
other one, come on in, baby. Let's sit and let's
Right.
talk about
Correct.
it.
Correct.
Right.
That's an excellent way to put it, because that is true.
That's right.
Wow. So we really need to be seeing nurse practitioners instead of the doctor. Is that what y'all saying?
That's right. That's what we're trying to tell you. Give it a try.
Okay. Note to self. Do the REMP. Oh my goodness. Yes. So also when we talk about just this being healthy, or trying to move to better health in 2025, if you had to give us like a top 5 list of things to do, or things to think about with our just general health, what would you kind of put out there?
Would say stress. That's the number one thing.
Yeah.
Stress would kill you for real.
Yeah.
Okay,
real.
decrease your stress. That's number one.
Yes.
Okay. We talked about nutrition. We talked about healthy eating. Try and fix your meals. I don't do it all the time, but try and fix your meals at home. We talked about exercise, family and friends. That's really important. Your circle of friends may not be a big circle, but you can have that 1 or 2, maybe 3 good friends that, will tell you what is right and not just a yes, person. The 5th one, what can I say? Enjoy life. Just enjoy, be happy, laugh like I always do. So that's it for me.
Nice. I like those. All right, Dr. Katoria.
She hit it on the money. She did. I couldn't. She hit the 5. I couldn't come up with 5. I was thinking in my head. I said I might have to, but she hit it on the money though. And I like the word you used earlier. Be intentional. Just be intentional. If you got your 5, be intentional about your 5. Small gains are still gains. Don't miss the forest for the trees kind of thing, or still don't miss the small gains again are just intentional gains, and pick your 5 and start there. If eventual weight loss is your goal, start slow. They say it takes 21 days to change your behavior. Just start there.
Which is not true. We go on a fast every year at church.
21 days.
And when there's 21 days up, we be ready.
What you were doing. I did it.
I think anybody could let something go for a little period of time. But if it's something they really want,
we got to be intentional though. But we remember the intentionality of it. We got to be intentional.
Day 22.
Yes.
You're going to get your French fries
again. get
They
these French fries
you
up
saw
for
Tanya
21
got the
days.
fries.
Let's get it too. I'm headed to give me some French fries. Oh my goodness. You definitely again have to be intentional, definitely about
Right.
your habits or whatever. But it was interesting, I think, the stress part.
Yes. And that's what she hit it on the head. Just starting off with stress alone. They always say stress is
Yeah.
the silent killer, or it leads to a lot of the other culminating things you probably already at risk for,
Yeah.
And
Stress is real.
yeah,
Yes.
we just spend so much time just going,
Mhm.
and adding to our plates and not, not just our physical plate with food, but just with our list of things to do
Mhm.
and
Right.
or people or not
Oh,
saying that we all are people pleasers, but we want to make people in our life happy,
Mhm.
whatever. You could be tired and your significant other or your child or whatever be like, can you do such and such? You like wore out, but you like, okay, well, let
Yeah.
me go,
Mhm.
go ahead and do it or whatever. And it's like the stress level and the frustrations that we have from day to day, whether it's work, whether it's personal, whether it's
yes.
this or whether it's that,
Mhm.
and learning how to manage that
Mhm.
stress.
With
Like,
laughter, though. She said the
I
laughter.
know,
Oh
right?
yeah. Yep. Live,
With the
love,
laughter.
laugh.
Live,
Mhm.
love, laugh.
Live, love,
Absolutely.
laugh. And know how to say no.
Yeah.
Mhm. Mhm.
Yeah.
That's part of that stress.
Mhm.
And especially when you have a lot of things going on, you have
Mhm.
family events, you have to, you're like my husband, we go everywhere, your significant other may just be involved in a lot of what's
Hmm.
going on, but you don't have to do everything.
Hmm.
Mhm.
You don't have to do everything.
Hmm. I remember one time I was talking to, or actually Dr. Friday Stroud had did a workshop for me one time, and we talk about this. Um, she used an analogy about balance, about
Mhm.
trying
Mhm.
to, find balance or whatever, and the whole what she said was so profound to me. She was like, "Life is not balanced." So
Mhm.
we will
Right.
stress ourselves out trying to find
Mhm.
balance. There are moments where you have to pay more attention to this than you have
Right.
that at the
Mhm.
time. She said her thing was quality.
Mhm.
Mhm. Mhm.
Was quality. If I only have 15 minutes to spend with you right now, it
Mhm.
just in this season or in this moment, then it needs to be the best 15 minutes.
Best.
Mhm.
Yes.
It needs to be
Right.
the best 15 minutes. I need to sit and pay attention to you. I need to put my phone away or
Phone
whatever
down.
it is. It's the quality. And I was like, oh my God, that is so true. Because we run around trying to make sure that we're giving everybody equal attention and
Mhm.
Yes.
the balance. And
Mhm.
I was like, oh
Yes.
my gosh, that freed
Yes.
me so.
Yes. And she should know because she was over a
I don't know
lot.
how she did it.
And right. And was doing it well. So
Mhm.
Yes,
yes.
yes.
So she knows.
Yes, yes. Um, let's speak to here's something that we haven't brought up. Sleep and rest.
I
Oh
was actually, when
yes.
she mentioned stress, I was going to say that segues into mental
Ah,
health with your sleep and rest.
whew, that's number one.
Mhm.
And this is something for me at this time because I'm normally asleep.
Oh yeah, that's right. It is a little.
Only for you, Lisa.
I
Only
love
for
you,
you.
Lisa. You know us Lisas gotta stick together.
That's right. That's right. I'm like, oh my gosh, that's a big one.
Mhm.
Rest, sleep. Because you can go, go, go. And I mean, you need, and it is true, you do need at least 8 hours of sleep, rest,
We gotta get 8.
uninterrupted. Oh, yeah,
Quality. It goes back to that quality.
that's right. I'm going to get 8 hours of sleep every night.
I never get 8.
I don't get.
Yes.
I get a full 8 when I go into the weekends. I don't always get a full 8, but it does. I can tell the difference if I went 2 or 3 days without my full 8. You will feel the difference.
Yes, I'm gonna get an 8.
She firm about her 8.
Yeah, I'm gonna get it. And my whole family knows. They know. When mama sleep, oh yeah, mama gonna sleep. Mhm.
So tell us
Yes.
in I guess the medical benefits to sleep and rest.
Oh, it's a lot from sleep things, even just sleep apnea. When you think about sleep apnea, sleep rest, getting your full 8 hours, stress, mental, your mental health, it's just where your body is healing itself while you're resting. She said it all. Go ahead, Dr. Gardner.
Yeah, and that has a lot. Just, I don't want you to try it, but we have seen it in patients. When you're not getting enough rest, your blood pressure stay elevated. Your blood sugar levels stay elevated. I mean, everything is just off because of lack of rest. And it doesn't necessarily have to have stress with it, but usually it goes hand in hand. But some people may not even have to be stressed, but they're always going. And they may be going, having fun, doing things, getting 3 hours, 4 hours of sleep. Your body is paying for it. You may be healthy, but internally, your body is paying for it. Like high blood pressure, what is that? The silent killer. A lot of people with diabetes, you're just going. You don't know is extremely high. So that rest and lack thereof could really do damage to your body.
So is there a difference between the actual sleep and rest? Like I might not get 8 hours of sleep, but I'm lounging for at least 2 of them. Does that help?
Because you're probably still on your phone. You thinking about what you're gonna do next, what you gotta do tomorrow.
Yeah, I usually am.
So you're not sleeping.
My
You're
new
sitting
goal,
back.
8 hours of sleep.
Try. You'll feel so much better.
What time would I have to go to bed to get 8 hours of sleep?
What time do you get up? So you have to go back. You have to start backwards. Move back. What time do you want to get up in the morning?
Usually I try to get up around 6:30, 7 o'clock.
You gotta be in bed now.
So you just go backwards and you're in bed 9.
Early.
4, 5.
She need to be in bed.
Oh,
now.
10.
10 o'clock.
10 o'clock is late for me.
When you don't get enough sleep, like she said, the blood pressure, the insulin resistance, you build up insulin resistance because your body is still moving and churning. Think about a car. A car gonna need gas. You're gonna stop, put gas in the car. You still drive. You still driving. It can't run on empty fuel tank.
Oh my
You got to
goodness.
stop the car, let the car rest, or even just like you got to change the tires on your car. You got to do all those things to rejuvenate your car. You got to do all those things to rejuvenate you.
I don't know.
And let me tell you, I'm so
in the
bad
bed
about.
at 10 o'clock, I'm sick.
I mean, I feel the same way as you. So, but I know what by the time the weekend get, I'm with Dr. Gardner. I got to go ahead and lay down or go sit down and whether I fall asleep on a chair or in the bed, you got, and it makes a difference.
It does. I'm so bad. It can be a show on. We're watching. I don't care about that show. I'm going to bed. There's a show going on, but I need my rest. Y'all tell me about it tomorrow. Tell me what happened.
I cannot imagine going to bed at 10 o'clock. Like,
I'm with you, but she is so right.
I am a night owl. It's awful.
Oh, let's see. I'm not. I'm a morning person.
But
I
try
mean,
one day.
ideally, if I could get up around 11 each day, that would be so beautiful to me.
Go to bed at 11. You say get up at 11
Get up at
a.m.
11. Yeah, no, 8 is too early. Yeah, go to bed at who invented this work day?
8 to 5.
I
Look,
can't
at
take
least
it.
we have some flexibility though.
Yes,
We
I'm
have
9 to 6.
flexibility.
I hate 8 o'clock. I'll do nothing at 8 o'clock. Don't ask me to be nowhere at 8 o'clock. I ain't gonna make it.
Look, but you can do anything at night. Hey, if they want anything done,
I'm a
that's
ride.
you.
I'm a ride with you at night. Yeah, yeah.
Oh gosh.
Oh my God, I'm terrible in the morning. I mean, I'm not cranky. Once I get up and out, I'm good. But it's that getting up. I'm like snooze, snooze.
No, I'm bright eyes. I'm like, ooh, come on, let's go. I'm ready.
Oh my goodness. Oh my goodness. I do love the fact that we brought up the laughter part. I think that is so important. Like laughter just lifts you in such a
Yes.
way. Yeah. A
Yeah, I'm
good
telling you,
stress
in
reliever.
my office, well, in my house office, I have live, love, laugh. You have to live. Okay. Enjoy yourself, go places, do things, live, love. You have to love. Okay. Whether it's your dog, your pet, your significant others, whatever, and laugh. Don't take everything serious.
Serious,
You know,
yeah.
you can have these people just so serious. You laugh and they just looking at you. I can't. Well, look, we know how to be serious now. We
Absolutely.
know how to be serious when it's time.
Absolutely.
But no.
Definitely. I love to laugh. Like yeah, I'm good with that one. Definitely
That's
good.
good.
Yes, absolutely. So, ladies, I certainly have appreciated you guys. We got just a few minutes left. What would you tell if so we got if it's multi-generational, right? So what advice would you give to, let's say, the Gen Zers versus Gen X, and then into the boomers when it comes to healthy living?
Can you tell them anything?
Well, now Gen Z probably not. Well, the boomers neither. You know our parents are a trip, ain't
Right. Oh no. Dr. Tori, I'll let you have that one.
they?
I know the Gen Zers, you might have to scare them with the fear of God. You have to scare them with death in order for them to get them to listen. You know, what they say, they'll be wiser but weaker kind of thing. Like they might know and think they know, but sometimes you got to really put some type of fear, you know. And some days, you know, nowadays, some of these kids not even afraid of God, you know.
No.
They're not even afraid of God, yeah. So you got to connect with them on whatever level it is you can and put fear. Typically they're afraid of losing something, even if it's not their life just yet because they're in their youth, but they're typically afraid of losing something. And if you can connect with them on a level of get them to connect and understand the correlation of their decisions and their actions and the consequences of what they might be fear of losing, sometimes you can get a change, or at least you can get the light bulb to make them think about the change kind of thing.
Well, yeah, they're afraid of losing their phones.
Yeah.
That's about it.
You better eat this broccoli. I'm gonna take that phone from you.
Right.
And sometimes it takes that. And the Gen X,
Yes.
they gonna Google everything. They coming. They don't care if you got the degree, if you got the knowledge, if you in charge.
Mhm. And Gen Z's, that's my son's group. I
But now,
just
did
don't
we
know.
think we were a little invincible too at that age?
Right. That's
I think they got it. They're a little bit more risk. They're a little riskier than we
I
are.
absolutely believe that they do take more risks than we
They're a
do.
little risk. Like I was in clinicals week before the snow. My daughter, who's a freshman at FAMU, called me to tell me her and her roommate and another little girl from Towers North, they're in the LLC too with journalism, that they were walking from over by the Cleveland Plaza to Appalachian Parkway to get to Miller Ave. At 7:00 at night, I'm in the middle of clinical. Right.
They walked into the
wow.
L house.
The L house. Yes. They didn't see anything wrong with that. Thank God they made it there safely. But
It was cold outside.
Correct.
And it's
And
snowing,
about
right?
to snow.
So this was right before the snow. But it was
right
still
before.
cool.
Okay.
Yeah, right before the snow. But yeah.
What route did that take? That seems so dangerous.
It was
Like,
but
ain't
that's
no
how
sidewalks.
that's how they think. And then when I eventually was able to talk to all three of them, the other two little girls was like, we do this all the time. And I'm like, ma'am, no ma'am. But yeah, I just looked at them and said, y'all are risky. This generation, they are so much more. You guess you could say courageous if you want to put a positive spin on it, but they are just gonna go or do.
Yeah.
And
But at least they
don't
went
think
together.
about it.
Yeah, at least they went together. Yeah.
At least they went together.
And at least she did call me to tell me what she was doing.
Yeah.
So
Yeah. Wow. Yeah, they are definitely risk takers.
Yes.
Which can be good and a little,
correct.
not so good at times.
Yeah.
But you gotta put some fear in them because at first they don't think about that. Hey, what ifs?
Mm-hmm.
What ifs? But you have to make them correlated. But yeah, these kids,
They're different.
Yeah, they're definitely different.
Mm-hmm.
Wow.
So, but you have to just let them know. You really have to just continue to try and educate, healthy living. I think it's going to go in one ear, go out the other, but they have to experience it themselves.
Mm-hmm.
So,
Yeah. And I think even for our generation, we're not as risk takers, but
no, Gen X.
We're more
Gen X.
We go
we're not
long
gonna take
range.
a lot of risks.
No, we thinking about the long range impact.
Right. Right. Yeah.
Whether it's going to impact our health, our finances, our way of life, that kind of thing. We're thinking about the long range planning.
Yeah.
Those kids
we had the practical teaching, really, kind of.
Yes.
Like you go to high school, you go to college, you get you a state job, and you retire.
That's right. Right. That's us.
Yes.
That's what Mom and them said.
These kids are becoming influencers, TikTok, and all that stuff.
We didn't do all of that. However, we did step out of some of the boxes and boundaries a little bit.
Yeah, just a little bit.
Just a little bit. Yeah.
But not too far.
Not too far.
Not too far. But this next generation, they like.
Yes.
Bye.
Yes. Yes.
Oh my goodness. So for our healthy living, for our welcome 2025 healthy living, we are going to get more rest.
Yes.
I'm gonna work on the 8 hours.
Yes. Just try. Let's try 6.
Count. Do naps count? Can I take a nap? Will that count?
Be intentional.
Right. Be intentional. Why don't you start with 6? Why don't you start with 6 to 7? 6 to 7 hours.
I gotta get six now because I'm
okay. Let's go to 7.
Like midnight, I'm like, okay, let me go ahead and lay it down.
Okay, let's increase it to 7.
Okay. All right.
And
I
then work
on
on moving to 8.
okay, I work on the 7. I work on the 7. More rest, reduce our stress.
Yes.
Reduce our stress, and then just kind of be more intentional about what we put in our bodies
Mhm.
Yes.
and listening to our bodies.
Mhm.
That when we know something ain't quite right, we need to pay
Mhm.
attention
Yes.
and not
Yes.
wait and see.
Mhm.
Yes.
Y'all know, so I'm not even looking at y'all like I'm looking directly at myself.
But that's good. That's good.
And just definitely live, love, laugh. Thank
And
you
Laugh.
for that, because
yes.
that is what we need to do. I
Yes.
appreciate you guys so much for hanging out. We gotta do this again. I gotta have y'all come back.
Yes.
It's still gonna be at 9:00, Dr. Lisa. I'm sorry.
Oh, I may have to call, probably miss that one.
Oh my goodness. Listen,
Oh,
if you are watching us on YouTube, hit the subscribe button, turn on your notifications so you will never miss another show. If you're watching us on Facebook, hit the like button. Again, turn on your notifications so you will never miss another show about what we're doing. This has been a great conversation with Dr.
yes.
Gardner, who is the Associate Dean of the College of Nursing at Florida A&M University, and then Dr. Katoria Westbrook, who is an assistant professor also at the School of Nursing at FAMU. It's Rattlers in the house, y'all.
Yes.
That's right.
Love it.
Yes.
Love it. And baby rattlers. That's
Yes.
That's right.
Yes.
All these rattlers.
yes. So we are gonna see you guys next week. We'll be right here back at this same time at 9:00, Dr. Lisa, 9:00.
Okay.
Right back at this same time next week. My Auntie V will be coming so we can have our tax talk. So
Okay.
we will know what we need to be doing for our income tax in this year, and some of the stuff we need to be looking for with this administration
Yes.
we have right now. I don't know whether
Absolutely.
I just need to leave the country for the next 4 years and come back. I'm not sure. But hey, we here. This what they wanted. This what they got.
Right.
Exactly.
Exactly.
Absolutely.
We are
That's what
gonna
I
see
say.
you.
But that's all.
Right.
That's another conversation.
It is. It definitely is. All right, guys. We'll see you all next week. Thank you guys for joining us.
Thank
I appreciate you guys. Mwah. Love you.
All right.
Right. Good night.
Bye.
Let's talk, let's talk. What you wanna talk about? Let's talk, let's talk. What you wanna talk about? Kitchen talk, let's talk. What you wanna talk about? Kitchen talk, let's talk. Conversations that cool. Kitchen talk, let's talk. What you wanna talk about? Kitchen talk, let's talk. Conversations that cool. Let's talk, let's talk. What you wanna talk about? Let's talk, let's talk.